Hey folks, I'm Howard Lux.
I'm Jeff Berg.
We are the Two Boneheads, bringing you about 20 years of experience, each of us, towards certain orthopedic maladies that you have some questions about. Today we're going to focus on medial collateral ligament injuries of the knee, or what we refer to as an MCL. The MCL is a ligament on the inner side of the knee. It helps the knee collapse inward. We see these injuries typically in certain sports. When do you see these most commonly?
Yeah, I think the most common thing for me is it can be any sport, but it's typically when somebody falls onto the outside of someone else's knee. Common in football because people are tackling each other and falling around. But I see it in soccer and other sports. There's acute pain on the inside of the knee, sometimes a pop, and often an inability to continue playing or at least even walking in some cases.
Right. These are very painful injuries. We'll get back to that in a second, because pain always doesn't give you a hint as to how severe the injury is. You could have a mild sprain, but really severe pain. So, I said mild. How do we look at these? How do we grade these? How do we determine how severe these injuries are?
Yeah, so like many things in orthopedics, we have a grading scale. And the simplest way I like to think about it is, when I test the knee, does it open up any more than the other sides? Meaning, as you said, the ligament is on the inside of the knee. So if I try to move the knee, moving the foot from the inside to the outside, then that will stress that ligament. And if the knee opens up a little bit, then that's a little different grade than if it opens up not at all. And then there's if it opens up a lot. And for me, that's usually if it opens up when the knee is straight and when the knee's bent a little bit. And I kind of grade those, not at all 1, a little bit 2, opens up both flexed and bent 3. And to some degree, there may be some way to estimate length out based on that. I use that somewhat to sort of prescribe my treatments. They change slightly. But I don't think the grading scale has a tremendous difference, although those bigger ones may be associated with other injuries.
Right. So I find most, especially if they're isolated and just involve the MCL, are grade 1 or 2 injuries. You agree?
Yeah.
Same. So the treatment of grade 1 and 2 injuries can be a brace if it's a grade 2 for a few weeks. And for a grade 1, you don't need a brace, but you might want it because these things hurt. I don't know about you, but I tell my patients that to anticipate a solid 2-3 months until this is going to calm down and start to feel good.
Yeah, I would say that I think, it clearly depends on the patient and the person. And I'm probably a little quicker than that. I find that at 4 weeks, those grade 1s often, not always, are doing okay. And some of those people, if they're really motivated, can be back to their sport and playing, particularly with a brace on like you described. But there are some patients, you're right, that I find for whatever reason that MCL shrinks or gets really inflamed. And some of those patients are really unhappy for a very long time. And it can be, you're right, 3 and 4 months sometimes.
Yeah, so I try to get ahead of it by having that conversation initially, in the office, that this, even though you don't need surgery, even though you don't really need a brace, you might not be back to sports, for 3, 4, 5 months. And it's not going to be up to me. It's going to be up to how you feel. Now, there's some controversy about these grade 3 injuries. So grade 3, really, from your perspective, out there, is a complete injury of the MCL. It's completely torn, and as Jeff alluded to, if we stretch the knee, it just goes. It doesn't stop as a normal MCL would. Fixing them? Are we not fixing them?
Yeah, I think it's interesting. I think so. For me, there's 2 different kinds of grade 3 MCL sprains. There's the grade 3 MCL sprain, where if I look on an MRI, there's some fluid in it, and maybe it's thickened, but it's not clearly pulled off the bone, or sometimes it can be pulled off the bone and flipped towards the joint. I think if it's pulled off the bone, flipped towards the joint, and associated with either a anterior cruciate ligament or a posterior cruciate ligament, those may need to be fixed.
Agreed.
And they probably should be fixed.
Agreed.
On the other hand, if it's just sort of stretched, I usually won't bother with that, and I'll brace that and let it sort of scar in.
Agreed. And I think what's critical to stress here is if you haven't been examined well and you're going by an MRI diagnosis, that might lead to an inappropriate treatment.
Yeah, I would agree. It is not uncommon for there to be MCL sprain on the report,
Right.
or grading of the MCL sprain, or even it looks really bad on the MRI and then not so bad on the exam. And so just like almost everything in orthopedics, an MRI without an exam is nothing more than a piece of paper.
Correct. You need to be examined, and if a treatment is going to be recommended, it has to be geared towards those examination findings. So if you have complete tears of the ACL and the MCL, or the PCL and the MCL, you're repairing both.
Yeah. Now, sometimes, it depends. I mean, those MCL, when you repair them,
Yeah.
sometimes they get real stiff, those patients. So, sometimes I might even consider doing that in stages.
Sure.
Maybe considering repairing that MCL, get the range of motion back, tackle the other ligament in another day or something. But yeah, I mean, fortunately, I haven't seen a ton of those, because most MCL sprains in sort of the basic sports will heal.
Agreed. Most MCL injuries will not need surgery. A brace for comfort for a grade 1 where it's stretched but not torn. A grade 2 and 3 might need a brace for a while, and very rarely a grade 3 will need surgery. But these can be a painful injury, so don't despair. Most people are back to sports within 3-4 months. If you have any questions, shoot them to us. We're looking for more topics to do. Have a nice day.
Take care now.